Right, so welcome everybody to number 4 in a series of WebExes that are being produced by Buurtzorg Britain and Ireland and delivered through the Neighbourhood Care Programme of the iHub, which is part of Healthcare Improvement Scotland. And number 4 is entitled Developing a Framework for Self-Managing Teams, and we're delighted to have Brendan Martin, who's the CEO of Buurtzorg Britain and Ireland, to deliver this for us. And a framework for self-managing teams is really important. It's an important aspect of any neighbourhood care model, because it's going to help set goals, it's going to help agree ground rules and professional competencies of the care providers, and also enables teams to work in a more self-managed way as well. So we're really grateful for your time, Brendan, and without further ado, it's over to you.
Thank you, Alec, and thank you, Sarah, and thanks to Healthcare Improvement Scotland for hosting these seminars, these webinars. As Alex said, this is the 4th in a series, the first of which introduced Buurtzorg, looking at its growth from a startup in 2007 to having some 10,000 nurses and nurse assistants in more than 950 teams today. The second webinar looked at the onion model, which, next slide please, Alec, which is, and I'm going back to that today as well, just to remind you, because this underlines that when you're thinking about a framework within which self-organized teams, self-managed teams or self-steering teams in an organization operate, they operate within a framework which needs to start from the primary purpose of that organization. And in Buurtzorg's case, Buurtzorg started with the intention of going back to the needs of people needing support, the person at the center, and simplifying all of the processes which have become, in the systems, which have become enormously complex over time. And the onion model represents really the basis upon which Buurtzorg teams provide care in their neighborhoods, starting with the intention of enabling people to live as well, as safely, and with as high a quality of life independently as home for as long as possible, as long as they want to. Doing that by mobilizing their own capacities and the informal networks around them, and by helping them to coordinate the whole system of health and social care that they need. And the third webinar looked at how the self-organized teams themselves function, and we mentioned in that seminar that the way the self-organized teams work is to work within a framework. And this seminar today is going to be looking in detail at how that functions, at what that framework is like, its importance, and what kind of elements should be in it. Next slide, please, Alec. So starting from that primary purpose, what Buurtzorg teams, self-managed teams, need to do is 3 things. And these, if you like, are the 3 pillars of the framework itself. The first is to provide great care to the people that they're supporting in line with their professional qualifications, in line with their vocational commitment, and keeping their continuous professional development up to date. The second is to work in a way that enables great job satisfaction and well-being, and if you like, fun at work for the teams themselves. And Buurtzorg has won Employer of the Year in the Netherlands several times, and that's proven up, as well as low turnover rates for the staff of about 4%, that Buurtzorg, as well as delivering great care, is achieving that outcome. And the third, you can't sustainably provide great care or provide great jobs unless your organization is financially sustainable too. So the third pillar of the framework in Buurtzorg is to make sure the organization as a whole is sound financially. And each of those goals in the framework that Buurtzorg uses and the frameworks that we help organizations in Britain to develop have a small number of ground rules through which they are achieved. So let's look at those in turn. In the case of great care, well, first of all, of course, the professionals that work in Buurtzorg and the professionals that work in health and social care are first and foremost responsible for their own professional standards. In some cases, as in cases of nurses, for example, of course, they're part of a professional body with its code of conduct and its own regulatory system to regulate and make sure that the professionals are operating in accordance with their code. But even when the staff concerned are not registered, of course, they have obligations to make sure that they are operating as well as they can, keeping up to date with continuous professional development and so forth. So that's fundamental. Also, if you're going to work in a self-organized team, you need to, which I'm going to come on to in a moment, you also need to have some understandings about how those teams work. To look at the great care piece for a little longer. In Buurtzorg, and a couple of the aspects of that are important is one, that Buurtzorg teams provide care 24/7. That doesn't mean to say that everybody in the team is available 24/7, but it does mean that the team as a whole has to work out a way that the team is contactable all the time, and if somebody calls in needing attention at night, that somebody will answer the phone, not a call center, but a member of the team who will be able to deal with it. Sometimes dealing with it on the phone, sometimes it will require a visit, sometimes it might need to be referred to, just, let's say, a GP or whatever. But that availability 24/7 is part of the framework that Buurtzorg teams operate within. Another is that they need to manage their roster in accordance with the needs of their clients rather than in accordance with the convenience of the team themselves. Now, of course, when you've got self-organized teams, in Buurtzorg's case of up to 12 people, of course, the different people in the teams will have different circumstances. Not everybody will be able to be available at all times. But as a whole, the team has to make sure that it is able to provide service at times when the clients themselves need the service to be provided. And indeed, this is just recently in Buurtzorg, there was a case of a team not wanting to provide service at some times of day, that it was very difficult for the team to provide service. And this led to quite a lot of discussion between that team and Buurtzorg as a whole as to whether that was permissible, and it wasn't permissible. It's a very important part of the overall Buurtzorg quality that the rosters should be predicated on when clients need them. So, and typically clients tend to want visits in the mornings and other times of day, but particularly in the mornings and in the early evenings. So that's an important part of the framework. It's a non-negotiable, if you like. There's so much of what self-organized teams do, they decide how to do it themselves. But what the framework does is provide the boundaries of that autonomy in terms of what is an imperative for the organization as a whole to be able to achieve its mission. The second category of goals is that the teams should enjoy their working lives. If you like, I'm summing it up as being happy teams. And there's a number of ground rules associated with that one too. One is that within the team, although the qualifications of team members vary and their pay levels also are not equal, because they depend on levels of experience and qualification. In Buurtzorg, there are 3 levels. Nevertheless, the team operates in making its decisions, in making its plans, in the way it operates organizationally without any hierarchy. Just because you may be the best qualified member of the team doesn't mean to say you have any more authority in the team as a whole. Of course, in clinical governance terms, you may well have, but in terms of the way the team operates as a team organizationally, you have no more say than the least well-qualified person. Another very important part of how the teams function is that there is a number of organizational tasks that are best done at team level And those tasks include drawing up rosters, mentoring newer members of the team, 2 or 3 other tasks which we've gone into in previous webinars. And although it's not a cast iron rule, the experience of Buurtzorg is that to avoid the emergence of hierarchies and to enable everybody to get as much satisfaction as possible from their working lives, those tasks are normally rotated. So again, that is in effect part of the Buurtzorg framework. And then the third goal is to be able to sustain the great care and the happy working lives. You need to have a sustainable organization financially, which is an aspect of Buurtzorg's success that's sometimes overlooked. And again, this is expressed in the framework in terms of some clear ground rules. One of them is that on average, teams should spend 61% of their time doing work that is billable, because we're talking about an insurance-funded system of health and social care. If teams fall too far below that number, and if too many teams do so, then Buurtzorg would be financially unsustainable. If teams are also too much higher than that 61%, it's going to be implying that they're not attending to some of the other things that need to be done to have an effective neighborhood team, such as having team meetings, such as reaching out to the community, such as building their networks in the community. So 61% is pretty much the minimum that is healthy for Buurtzorg, but any more than around 65% would probably be eating into some of the other activities that healthy teams need to do as well. And it's no good doing that time unless you're registering it accurately too. So there's an obligation on teams to make sure that they're keeping up to date with the registration of their time, so that when the support center or so-called back office in Buurtzorg is sending out invoices to the insurers, that the information in those invoices is accurate. So we have in a framework 3 sets of goals. You don't have a long handbook, you don't have lots of policies, you don't have lots of rules. You have a framework aimed at those 3 goals with a few simple ground rules associated with each. In Buurtzorg, because of the way that Buurtzorg has developed over the last 12 years now since it was founded, really these are embedded in the organization as the cultural norms of the organization. I've spoken to some teams who are very aware of the framework in an explicit way. I've spoken to other teams who don't even talk about the framework, but nevertheless understand everything that's expected within that framework. And that's the extent to which they're embedded as cultural norms. But in the Netherlands, and we've also found the same in Britain, if you're working to establish this kind of organization, or particularly if you're working to change from within an organization that has got hierarchies, that doesn't work in accordance, and perhaps has many, many rules. We've come across organizations with handbooks with 1,500 rules in it that nobody can tell you what they are. When you're changing an organization like that to work in the Buurtzorg way, we have found that to begin with at least, the framework needs to be explicit. Next slide, please. Of course, as well as your own goals, as expressed in the earlier parts of my talk, there may be other things that the organization has to take into account. Obviously, fundamentally, what the law requires of the organization. That can affect employment terms and conditions, for example, or basic standards of care. What does the regulatory environment require? Which of course is a continual continuing on the minds of all health and social care organizations, even if they think that some of the regulations are more useful than others, serve a better purpose than others, they're still non-negotiable. And then there may be agreements, such as industrial relations agreements or other agreements about that also have to be complied with. Now, does this mean that all of those different considerations need to be written into the framework? Well, the answer is that needs to be thought about Sometimes it might do. We're supporting some organisations in Britain, for example, which require all staff to be reasonably familiar with, I'm talking about the English context now, require them to be reasonably familiar with the policies and approach to inspection of the Care Quality Commission. But at the same time, you wouldn't want your teams to have to worry too much about what the Care Quality Commission or any other regulator thinks. As much as possible, you would want to simplify the processes in the organisation, simplify the way in which the organisation as a whole makes sure it complies as a whole and at each team level with the regulatory requirements. And the way Buurtzorg does that is not to bother the teams with what the organisation as a whole needs to think about in terms of regulation, but to have a simple framework in which if the teams deliver great care in accordance with the framework, the regulatory piece will take care of itself because the quality will be high, because the record keeping will be good. And so long as those things are happening because they're goods in themselves, the service centre or the back office can make sure that any paperwork for the regulator is also complied with. So it can be important to think about when you're developing a framework for an organisation operating through self-managed teams, to think about what are the aspects of quality, safeguarding, compliance, and so on that you require to have in to be running through your organisation, but it doesn't necessarily mean that they have to be explicitly referenced in the framework. That's something that needs to be thought about. Next slide, please. What we found is, and we run workshops with organisations to help them to develop their framework, and the starting point is always to work with the senior leadership of the organisation to start with what is your primary purpose? What are you trying to achieve? What are your goals in terms of achieving that primary purpose, just as I've tried to outline in the webinar. And we try to get them to express those goals as simply and as clearly as possible, and to think about the kinds of ground rules that they would want to have in order to meet those goals. Sometimes they say, in fact almost every time, the organisation says, well look, can you give us an example of a framework that works in the Netherlands, for example, or in one of your other organisations that you support? And that's always a dilemma for us, because on the one hand you can see why they would want to not reinvent the wheel, but on the other hand, unless an organisation is really thinking about its purpose and its goals and going back to those basic principles in developing its own framework, it can be an avoidance of really thinking through the logic of the framework. So sometimes we try and strike a balance there. Another part of it is we say, keep it small and keep it simple. Well, that's practically a mantra of Buurtzorg, as I'm sure some of you will already be familiar with. But it applies very much to the framework. We tend to think that you should be able to contain the whole expression of a framework, the goals and the ground rules associated with it, on 2 or 3, at the most, sides of A4 paper, if not less. A very big difference from the lengthy and highly detailed handbooks and policy books that organizations need to have. And what its job is essentially to do is to define the boundaries of autonomy for self-managed teams in terms of the overall goals and ground rules of the organization, but enabling the teams to know where that boundary is and to work out their own ways of delivering that purpose within those boundaries. And very importantly, to do that not in terms of exceptions to the rule, but in terms of norms. If you look at the handbook of many organizations, you'll find that, and some of you may have heard me quote one of my favorite examples of a handbook that we were looking at in an organization that we've been supporting, which was telling the staff exactly how to open a window if they're in someone's house. Well, you're talking about intelligent people who know how to open windows, but you can imagine how that happened. What happened probably was somebody probably injured themselves at some point, so they thought, well, we've got to cover the organizational risk by having something expressed in the handbook about how that should be done. But the best frameworks, instead of trying to account for every single exceptional, rare occurrence, are those which express what is the norms expected of how the organization functions and what's expected of the teams, and to define boundaries in that way. But what we've also found in Britain, and I think this is important, is whereas in the Netherlands, both in Buurtzorg itself and in the organizations with which it's had success in supporting them to make a transformation to work in the same way as Buurtzorg, and there have been two outstanding examples of that. Those organizations have very clear leadership that that at the same time as supporting the development of self-organized teams, are undertaking the sometimes, or indeed invariably, radical organizational changes that need to be made to support those teams. Changes in the way that the financial systems operate, the HR system operates, especially the IT system they operate, and getting rid of unnecessary administrative systems and instead making sure that the organization is focusing on what really needs to be done to support the teams to deliver the primary purpose well. What we found in Britain increasingly, though, is that the teams that we've been supporting sometimes are frustrated by the extent to which the organizations behind them are not responding quickly enough to the organizational changes that are required to enable those teams to really function as well as they can. Despite that, we find that the teams never want to go back to the previous way of working, and nor do the people that they care for. Nevertheless, there can be frustrations which can also undermine the third goal, which is financial sustainability and really sound finance. So what we're finding increasingly is that a good framework not only expresses what is expected of the teams themselves, but also what the teams can expect of their organization as a sort of a framework of mutual understanding and agreement about how the organization as a whole should operate. So the process that we tend to work with when we're supporting organizations is first to start with what is the organization's goal, and that's a matter for the organizational leadership, but then take that into a dialogue with the teams themselves at the front line, enable those teams to express their views about the framework, what's expected of them, and what they need in return from their organization, and develop, if you like, a memorandum of understanding, as one of the organizations that we're supporting has called it, that provides for those mutual expectations. It's too soon to say how sustainable that will be, but so far that's been the result of our experience, and we're beginning to develop some very effective frameworks by working through that process of dialogue and developing a set of mutual expectations to enable all parts of the organization to understand what they need to do to provide, to create the right organizational environment to enable self-organized teams to deliver great care in financially sustainable ways. Next slide, please. And that's all I've got to say in this seminar. The next seminar, webinar, the next of the series, will be looking in more detail at the organizational challenges associated with enabling the the corporate services within an organization behind the front line to support the front line effectively. As I say, our experience with the framework is that they need to express those mutual expectations, and in webinar 5, we'll look in more detail at those issues. But I hope that's been helpful at this point, and look forward to any questions you've got. Thank you.
Thank you, Brendan. Very helpful. And we've put up a slide there with the webinar number 5 and 6 on the screen for everybody, because mindful that the original communications out had the topics in reverse order, so we've swapped them around, the same titles, but number 6 and number 5 and number 6. And I believe that that's because we have somebody joining you, Brendan. Is that right?
Oh, it's partly because I think the logical flow of the sequence is better this way, but it's also partly because for the webinar 6, I'm not a team coach, so I want to be either joined in that one or have that one delivered by an experienced team coach. And the person I have in mind is not available in March, but is available in April.
Great. So we'll look forward to that. Thank you. And while you were talking, it was great to see that it has people dialing in all the way from up top in Orkney in the UK all the way down to Stockport. And we do have a couple of questions from those. If you unmute your lines, feel free to ask them to Brendan. So if you do that now, otherwise we could ask the questions for you. So we'll just have a pause for a couple of minutes if you want to ask them. Sounds like you're all too shy. Sorry, on you go.
Hello, it's Judy here in Orkney. Hi there. It's just that one of the questions I wanted to ask was around about the 24/7 aspects to it. And how does this fit with sort of working time directives and agenda for change? Has that been a problem? And has it been a problem given adequate time off if the staff are called out? And is that an obligation that's ever been too much for some staff and have put staff off? So there's quite a few questions in there, I'm aware.
Shall I answer that one now?
Yes, please. We've got another 2 after.
Okay. So that was an example of one of the ground rules in the Buurtzorg framework in the Netherlands, Judy. However, some of the organisations we've been supporting in Britain have also decided that they want their teams to be available 24/7. Others haven't. Others have decided that they want to run a service, for example, at 12 hours, 8 to 8, and then some other part of their organisation will pick it up in the rest of that 24-hour period. But some have decided on 24/7, and they've operated it very similarly to what Buurtzorg have done, with typically one member of the team holding the team phone at any one time out of hours and dealing with whatever inquiries might come up. Interestingly, when teams are available 24/7, the phone very seldom seems to ring out of hours. And that's because, I think, of the way the teams work with their clients most of the time. I'm sorry, if you like, in the let's say the 12 hours of normal time, to anticipate the kinds of issues that might come up for their clients outside hours. So, and also it tends to give confidence to the client that if they do need to call, they can, but quite possibly what they're worried about might wait. So it's interesting that the phone seldom rings. But as far as I'm aware, the organisations in Britain that are working with 24/7 availability of teams have found ways to reconcile that with the Working Time Directive and the Agenda for Change and so on. How they've done that, I guess, varies, and we're just about to open up an online service called Buurtzorg Community, which is a sort of a learning network, and the idea of that is to enable organizations and teams working in this way around the country to make contact with each other, to ask precisely this kind of detailed question of each other and build up, if you like, a peer support across the country. So hopefully that kind of initiative will help you to answer some of those questions, but also we keep taking notes of the kinds of questions we're asked, such as you've just asked, and we'll try and come up with an answer to that we can put online as well.
Lovely. Thank you very much.
You're welcome.
Thanks, Judy, and thanks, Brendan. And I have a question here that's kind of linked to that. I think the network's a great idea, and we are often asked as well for people, like you said, Brendan, and I'm conscious of Margriet's presentation last time, that she's the first thing that any team should have is a framework. And we've often been asked, can we see examples of those? And you said that you're conscious not to share specific examples of frameworks to maybe influence their journey, but where could you, if you wanted to, find an example of what one looked like? Is it in a table form? Is it 50 sheets long? Is it 3 pages long? If someone was interested to find out an example of a framework, where would they look first of all?
Well, we can certainly, I did say it's a dilemma for us. It's not that we don't share when of course, the organisation we're working with is willing to share. Some are more willing than others. But where they're willing to share, we've got no problem with sharing. It's just a dilemma. Sometimes we have found that instead of thinking it through, the organisation will say, okay, we've got this framework, just top and tail it differently, and Bob's your uncle. And we think that that's not a good idea from the point of view of their own learning and development. But of course, in the context of doing some basic work in an organisation to develop your own framework and to develop it from your own starting point, your own primary purpose, your own values, and your own goals, and making sure all of those aspects are expressed in it, it can sometimes be useful to look at an example. And we're very happy to share one or two examples that we've got with anybody that would like to see one.
That would be fantastic. And I'm just mindful that we have the knowledge sharing website, which is for a members only access. Is that something that we could perhaps put there if anybody's interested?
Are you asking me?
Yes.
Yeah, I don't think we'd have a problem with that at all, Alec.
Great, thank you. And Sarah has one.
Yeah, we've got a question here from Helen. So she says the Care Quality Commission requires organisations to have registered managers and their responsibilities cannot be taken by a support centre. The registered manager is expected to demonstrate them. I don't know if, Helen, you want to expand on that a little bit?
So I can't get audio. So I suppose similar to issues up here, Brendan, the Care Quality Commission need to have registered managers, and the responsibilities are explicitly lined out, and they cannot be taken by the support centre, so they can't devolve those responsibilities somewhere else. Sorry, on your experience in England with the same kind of...
Yeah. Firstly, hi, Helen. I'm sorry we can't hear you, but it's good to know you're there. And as Helen knows, the CQC has also recently made it clear that they're not standing in the way of the accountability and safeguarding that can be done in self-managed teams as a legitimate organizational way of maintaining accountability. And so what we tended to find in the organizations that we're supporting, yes, of course they have to have registered managers. So they have a registered manager and they have processes to enable the compliance with the CQC requirements to be in place and manage that relationship with the teams in a way that is as little intrusive as it needs to be to support the self-management of the team itself. So there are, I think the conversation is developing in a very promising way with the CQC itself, as it is with the mental block on the equivalent in Scotland, remind me, Alec.
Is that the Care Inspectorate?
Yeah, the Care Inspectorate. Yeah, sorry, mine went blank there. So the conversations with both the Care Inspectorate and the Care Quality Commission, I think in terms of developing an understanding of what they need in terms of their comfort with safeguarding is compatible with self-management of teams. That conversation is going well. In the meantime, as with many other aspects of this transition, various organizations are coming up with different approaches to making sure that the CQC is satisfied and at the same time the teams are able to have the right levels of autonomy to be able to function as self-managed teams. But that can sometimes require you to have this explicitly expressed in the framework. So either in a form that the teams are able to report to the organization as a whole satisfactorily, or able to, or else it's explicitly a responsibility for the teams. Different organizations are handling that in different ways.
Thank you, Brendan, and thank you, Helen, as well, who in the chat box said that she's happy to now share how this has been addressed. If people want to see how the CQC have publicly made a statement of self-managed teams or well-being teams in brackets and quality. And I suppose a similar kind of story to us in Scotland, where the care inspectorate have really been instrumental and very supportive in sandboxing our teams that are piloting neighbourhood care principles and neighbourhood care teams, and also they're very much part of our steering group, our national steering group, ever conscious that they want to make their inspections the starting blocks for where improvement can happen, and not be really focused on that scrutiny or assurance or rigour of inspection, but maybe open up for a more quality improvement journey after inspection. So,
can I just jump in, Alex, and say that I think that sandboxing approach is really helpful, and particularly in the transition. But alongside that, having the conversations with the regulatory bodies and the inspectors, the inspectorates, to enable, because these, in some ways, you can look at the sandboxing approach like many other transition get-rounds as something that is well suited to the transition. But over time, what we'd hope to see is in order to get that sustainable and at scale, a different kind of approach to inspections themselves. So, for example, in Buurtzorg, it's taken a number of years to get there in the Netherlands, but now the approach to inspection itself has changed, so that there's much more speaking to the team members, speaking to their clients, less reliance on tick boxes and filling in forms, and looking at all the procedures and processes. I'm not saying those things aren't important, but the inspection approach that is being taken in the Netherlands over time has come to be highly influenced by the success of Buurtzorg itself, and I'm sure we all hope that that will happen over the next 10 years in Scotland and England too.
Thank you. And again, just because Helen will not be able to have audio, she said the CQC decided that they did not need to change the way that they inspected, but expected different information from us. So again, good to hear, Helen, and sorry that you can't have audio with us too. Mindful of your time, Brendan, mindful that we've taken more of your time than we said we would last time too. So we'll plan to begin and end these within 45 minutes if we can. So with that in mind, thanks everybody for joining. Of course, as always, these are recorded WebExes, and the recordings will be shared via the email contact list that we have. If you want to be part of that email contact list, then please email us with the email on the screen at livingwell@nhs.net. Also, please feel free to share the email or the diary invite if you have one, and if you'd like to send that diary invite, again, please email us at Healthcare Improvement Scotland, and we'll forward that on to you as well. Great to see colleagues in NHS England come and join us today. So that's all that I have to say. Thank you very much, Brendan, for your time. Thank you very much for joining us. And Sarah, anything else?
Nope, that's all. Thank you.
Great. Well, thank you very much, everybody. See you again next time. Bye-bye.
Bye-bye.